We have been going through a very difficult time caused by COVID-19. It has highlighted many of our limitations. It has pointed to some essential facilities. What should we have been with us to respond to the life-saving emergency? One of them is the medical equipment, particularly ventilator. Despite very low efficacy, ventilator is still an useful thing to offer oxygenated air to the lung, to the critical patient, to extend the life a little bit longer so that infected person, critically sick individual could get a little bit additional time to give the immune system a little bit more scope to respond to the attack of virus. It has been found many of the developing countries do not have adequate ventilators. They do not have local capacity of producing them. Now, due to the breakdown of the supply chain, how to get them from abroad? And that is raising a question. Should we focus on particularly developing countries, localizing the medical equipment industry? It is a large industry, generating more than $400 billion revenue. And it will keep growing without facing any limit virtually, because we will have aging population. And due to worsening environmental condition and other situations, we'll be increasingly facing adverse health issues. And one of the things what we need to deal with them is medical equipment. But this whole $400 billion industry is now in the hands of a few multinationals of advanced countries. Developing countries do not have basically any pie of this. It is not only business opportunity, it is most importantly, it's a life-saving requirement. So what should we do to empower developing countries to produce their own medical equipment? Does it mean they should just acquire the capability of make them? It doesn't. It doesn't help them much, because value addition out of labor in making is extremely low. These are very technologically sophisticated equipment. So value addition is primarily through intellectual assets. Often they are patented. And these patents are in the hand of multinationals. So yes, patent is a barrier, but is it the only barrier? As for example, we negotiate with the international community and make patents open to certain developing countries for a certain period of time. That might build manufacturing capability, but it is not sufficient, because these equipments are amenable to advancement or making successive better versions, often at lower cost. And that is the reason developing countries should focus on acquiring the capacity of producing knowledge and turning them into ideas and integrating them into medical equipments so that they can redesign them, so that successive better versions they can produce. So they may start with certain equipment like ventilator, with certain permission and even licensing patents from multinationals, but they need to focus on research and development for producing knowledge and ideas so that they can succeed in getting into the process of redesigning them, in making them better and cheaper. Otherwise, this just ability of manufacturing and offering the protection to manufacturers wouldn't produce any good to any country. So instead of giving protection, of acquiring the capability of making to make profit by just producing replicas shouldn't be the focus. Focus should be on acquiring the intellectual asset generation capacity so that developing countries keep growing to produce better versions of existing products and eventually innovating new ones. This is a vital area where every developing country should be very serious, and it could be the beginning of producing intellectual assets based industrial economy in developing countries.